So my name is Rachel Kozar. I am a nurse scientist at Dana-Farber Cancer Institute. And at SGO today, I'm presenting the findings from a pilot feasibility randomized controlled trial of Bolster. And Bolster is a nurse-led telehealth intervention for patients with peritoneal carcinomatosis and their caregivers. We know that patients with peritoneal carcinomatosis experience reductions in health-related quality of life, particularly because of symptom burden. And very often palliative interventions like placement of an ostomy or a drainage tube can improve symptom burden. But we've heard from patients and their caregivers that they really encounter challenges when they're sent home after a hospitalization and need to manage these new complex care needs. So the purpose of Bolster is to provide longitudinal support from a trained oncology nurse over telehealth. Patients who receive Bolster meet with the nurse, typically over Zoom, 6 times over the course of 4 weeks. And the nurse provides skills training, discharge education, coping support, and care coordination. And so we recently finished a pilot randomized controlled trial of this study. And the purpose was really to figure out, is Bolster feasible? Is it acceptable? And is it potentially efficacious at improving patients' quality of life and other health outcomes? And what we did was we randomized patients and their caregivers 1-to-1 to receive either Bolster, which is the 6 visits, or enhanced discharge planning, which is 1 visit. That also included the education and care coordinations. From our pilot randomized controlled trial, first we found that conducting a full-scale trial of Bolster would be feasible. We consented 76% of patients that we approached. And we found that the patients who received Bolster reported that they were satisfied with Bolster and that they would recommend it to others. In addition, looking at some of the exploratory outcomes, we found that in the Bolster arm, compared to the enhanced discharge planning arm, a greater proportion of participants experienced clinically meaningful improvements in quality of life and self-efficacy. In addition, we found that patients who were in the Bolster arm had higher rates of documented advanced care planning in the medical record. And so what this tells us is that Bolster is potentially efficacious. This was not a full-scale RCT, it was a pilot feasibility study, but it does give us a little bit of a clue into the fact that pursuing a full-scale trial of Bolster is worthwhile and that it has the potential to improve these outcomes in patients who receive it.